Hello everyone and welcome back to another edition of IPC in Action, our Infection Prevention and Control podcast. My name's Jen, I'm one of the senior infection control nurses working in the organisation.
Hi everybody, this is Fran, one of the other infection control nurses. So today we're going to be discussing measles. Now I'm sure a lot of people have heard about it. It's a bit of news around the hospital and also nationally at the moment. It's been in the news quite a lot, so we're just going to go into it a little bit and give you a bit more information. So measles is a highly contagious and preventable disease that is transmitted via tiny airborne droplets of contaminated mucus. It's the most infectious disease that we have on the market, and just 15 minutes of face-to-face contact with no vaccine, there is a 90% chance of contracting it.
That is high.
Very high, very, very high.
So what are we talking about with like an incubation period then?
So with the incubation period, it's about 10 days, but it may be 7 to 18 days from exposure until the onset of any fever, and the rash usually appears around day 14-ish.
It can always get a little bit confusing when you start changing the days and sort of being, well,
numbers.
It might be this, it might be this.
Absolutely.
One thing we need to allow for a minimum of 18 days, really 21 days.
Definitely.
Within that time period, it might appear at some stage.
Yeah.
I think on average, it's normally around day 14.
Yeah.
Which is quite a long time
Yeah,
after
it is.
like exposure, isn't it?
Absolutely, 100%.
So some of the main symptoms that one might get if they have contracted measles is a raised temperature, a runny and blocked nose, sneezing, coughing, red, sore, watery eyes, sometimes conjunctivitis, sometimes with that weepy, pussy, lovely look around the eyes, and some enteric symptoms. You can have vomiting and diarrhoea. What's quite classic in measles is these little white spots that can appear in the mouth, which are called Koplik spots. And a couple of days after this, a rash tends to appear. It's a sort of dusky rash that can appear a few days afterwards with raised spots on the face, and it then normally travels down to the neck and the trunk of the body.
Yeah.
One thing that's really important to bear in mind for any clinical assessments is this rash can be less obvious on black or brown skin, and that must be taken into account when you're looking at the entire clinical picture to make sure that things aren't being missed because they might be visually less obvious because of the colour of somebody's skin.
Definitely.
So what kind of complications are we looking at? What things can happen with measles?
Things that can happen. So, there are a couple. We have things like laryngitis, bronchitis, encephalitis can occur, even so far as to blindness, and most extremely is death.
Yeah, so in very, very severe cases.
Yeah, we don't want to concern people too much with that, but it's something to be aware of. So those most at risk of contracting measles it can be anyone really, but it's most common in children. Also, people with no immunity. So if you are not vaccinated or you're vaccinated but you didn't develop immunity, so the vaccine is called the MMR vaccine. And it's for measles, mumps and rubella, you usually have as a child, and also people that are immunocompromised as well are at most risk.
So it is part of our standard child immunisation schedule. But what we have been seeing is that vaccination rate has been dropping off in the last number of years.
Yeah.
And what's happened as a result of that is as the vaccination rate is dropping off, herd immunity, which is the protection for everybody provided by the majority of the population getting this vaccination, has also dropped off, allowing this preventable disease to spread.
Yes,
and it's not just spreading in the paediatric population; it's within the adult population as well.
Definitely. Speaking of spreading, I was going to
yes.
say, speaking of spreading.
A lovely segue there.
So spreading, Jen.
So it's spread by contact with infected nasal or throat secretions. So this can happen if those nasal or throat secretions become airborne. And it can also happen if you touch a surface that they have landed on, and you put those viral particles to your face and to your mouth and to any of your mucous membranes.
Absolutely.
So the virus can remain active and contagious within the air and on contaminated surfaces for up to 2 hours. So it's quite a hardy little virus that can survive for a bit of time outside of the body.
Definitely. So some of the infection control measures that we want to put in place for suspected and confirmed. So first of all, one of the most important ones is that if you have, say, a suspected measles case presenting in ED, SDEC, children's, then you need to inform us, the Infection Prevention Control Team, or a consultant microbiologist if out of hours on all suspected cases. So
yes, please.
no hesitation. It's better to be safe than sorry.
Absolutely.
So just inform us as soon as you can. They need to be isolated immediately if suspected or confirmed. Ideally, that room definitely needs to have an ensuite because we can't have someone walking around.
No,
with
exactly.
suspected
And
measles.
if there isn't an ensuite, which there isn't with a lot of our side rooms, there needs to be a dedicated commode for them to use the toilet.
Absolutely. So rash onset is, so in terms of the length of time, so we class rash onset as day 0.
When we're talking about sort of how long to isolate somebody.
That's the one, yeah. And this continues for 4 days. So just making sort of really documenting when this rash started, and then we can kind of count down from there.
Yeah. And as Fran said, so when that rash appears, that day is day 0. We would then count 4 days. After 4 days from rash onset, as a minimum,
Yes.
We could then start to consider them as non-infectious.
Yes, de-escalation.
So PPE.
Yeah. So the precautions that we need to be taking when caring for somebody with suspected or confirmed measles are respiratory precautions. So upon entry to the room, you need to be wearing an FFP3 mask. You need to be wearing eye protection. You must have an apron, gloves, and this is just, as I said, on entry to the room until more than 4 days after the rash appears.
Even if you're popping in to drop off some tablets to give them a cup of tea, you must have those respiratory protection because, as we've said, those particles can remain airborne for a length of time.
Yeah.
Please make sure that you're fit tested for those masks to ensure that you're giving yourself the highest level of protection.
And another important one to highlight, and we'll go into this a little bit more slightly later on, is that only immune staff are to have patient contact with somebody with suspected or confirmed measles. This is really important. As we said, the chance of contracting it is very high if you're not immune, so that is a really important factor to consider.
That chance of contracting it is also if you're not wearing appropriate PPE.
Yes.
Now, when we're wearing our appropriate PPE, you are... with that, when you're using PPE appropriately, you have that enhanced level of protection to hugely reduce the chance of you getting it.
Yeah. So another thing that we as the infection control team will do is that if we have suspected or confirmed, that we will contact trace. So we'll support contact tracing if required for patients who have been exposed. Face-to-face contact of any length or more than 15 minutes in a small confined area, or even where PPE, as Jen was just saying, is not being worn, is considered as an exposure and will require a follow-up. We have a very short window from exposure. It's a short window of 7 days to complete our contact tracing and to get everything in place. So even if it's over the weekend, that's why we're emphasising how important it is to get in contact with the microbiologist out of hours. You can contact HPT as well. Again, we'll go into that, but it's something that we need to get started as soon as we possibly can.
So looking at sort of cleaning, when somebody leaves a side room, like we'll rabbit on about the entire podcast, suspected or confirmed, that room needs to be amber cleaned, please. So an amber clean is absolutely sufficient for killing that virus. And the green wipes are also the product that we need to use to clean down any equipment that is used by that patient.
Absolutely. And speaking of transferring a patient, so if a patient is moving around, then they need to be wearing a surgical mask if they can tolerate it. It's really important to emphasise here that patients are not to wear FFP3 masks. No. They're not fit tested for them. They don't need to wear them. No. So surgical mask, please. If a patient has measles, this is also just an adage, they should be excluded from nursery, educational settings or work until full 4 days after the onset of the rash. And this is the same for staff that have measles as well. Yeah. And again, just to add on, the best protection is the MMR vaccine. Yeah. So
it offers a fantastic level of protection.
Yeah, it is brilliant.
And like we've said, this is preventable. Definitely. This has come back as a as a result, unfortunately, of a drop in vaccination rates. So how do we test for it? We need to use the green virocult swabs. It's a throat swab that's taken. So these are what we sort of often describe them as when we're chatting to people on the phone.
Yeah.
People will ask, is it a wet or a dry swab? Because that's what we've sort of gone through quite a bit with COVID. This one is a wet one.
Yeah.
It's a PCR test, and it's the green tube,
Yes.
with the green swab with a little bit of liquid in the bottom.
Yeah.
And that is a PCR test that's done on the throat, and it can just be requested on EPR.
So this this virus, it is notifiable to the health protection team. So you do need to speak to health protection, and you need to complete a notification of infectious diseases form if it is a confirmed case of measles.
And we can obviously assist with all of this.
100%. And our noise, well, we call it a noise form, just as a shorter one. It's on our infection control pages on the intranet. So to contact the health protection team, I'm going to say a number, but just to reassure anyone, any kind of links and numbers we are going to include as a separate sort of link for the podcast, so you know who you can contact if needed. So the number for the health protection team is 0300 303 8162. But as I said, we'll include that all later on, so you've got it there. So can you give us a definition of occupational exposure?
Yeah,
contacts?
So this is going to sound a little bit like I'm reading from a script, and the reason is I am.
Yeah.
Because it's quite complicated.
Yeah.
So a healthcare worker is considered to be exposed and or a contact if they have face-to-face contact of any length or spent more than 10 minutes in a small confined area with a confirmed measles patient without wearing appropriate respiratory protection. If appropriate PPE is worn, the healthcare worker is not considered exposed. So if you've got your FFP3, your visor, apron and gloves, you are not exposed.
Yes.
The most important aspect of the PPE is the mask and the visor, protecting those mucous membranes so that those viral particles can't get in there.
Absolutely.
If you are deemed as a contact and you're not immune, you will have to be excluded from work for 21 days. Now, that's a long time.
It's a considerable length of time when you think about it.
And this can have quite disastrous effects on our staffing, which we know is sometimes not fantastic.
Yes.
So how do we, so the big issue is, and it's the 21 days if you are not immune. How do we know if we're immune?
Yes. So immunity status. So the protection of all healthcare workers is especially important in the context of their ability to transmit measles or rubella infections to vulnerable groups. So while they may need an MMR vaccine for their own benefit, including protection against mumps, they should also be immune to measles and rubella for the protection of their patients. So satisfactory evidence of protection would include documentation of having received 2 doses of the MMR vaccine, or a positive antibody test for measles and rubella. So everyone can access their immunity status, but currently, due to this sort of becoming, I think, a more obvious issue perhaps, ED, paediatric staff and SDEC areas are being prioritised to check their immunity status.
Yeah, and this is checked through Working Well. Managers are not allowed to get reports of their staff from Working Well. Each individual has to request this immunity report. Even if you are happy for your manager to have this report, they will not give it.
Yeah.
It has to be individually requested by the person involved.
Yeah, and we really encourage you to share this with your ward manager, because we don't want to have any surprises, say on a weekend where someone's having to rapidly call up saying, "Oh, you immune to this?" And
and we don't want to wake you up if you're asleep after nights
absolutely,
and stuff like that.
100%. So it's important to get that done when you can, but obviously bearing in mind our prioritisations for ED, paediatric and SDEC staff. So if you're unsure of your vaccination history, there are a couple of ways. I know Jen's just spoken about Working Well, so we'll give you some contact details for them. But you can also check it on the NHS app, and you can see a list of vaccinations right up until your very first one, so when you were a child, and the dates that you had them as well. Working Well, as Jen says, so their telephone number, again, it will be linked, is 01452 894480, and their email address is workingwell@ghc.nhs.uk.
What's worth considering is if you're below the age of 20 years, you can contact the Child Health Information Services for the area that you grew up in. For Gloucestershire and local surrounding areas, the contact details are 0300 5611 853. Child Health Information Services / local government organisation. Sorry, not organisation, association.
Association. So also to note is that Working Well are offering daily clinics Monday to Friday, 9 a.m. until 3 p.m. for clinical patient-facing roles for staff from Gloucestershire Hospitals, Gloucestershire Health and ICB staff.
Obviously, that also includes GMS.
Yes, absolutely. And again, we noted their telephone number and email contact earlier on. So to round off, if you have any queries whatsoever, we have additional resources on the intranet pages, and this is currently on the main page, and we'll be updating them regularly and also updating an FAQ section as well, just to answer anything you might have.
Yeah.
I think it's important to note, we don't want to scare anyone with this. This is just all the hopefully important and useful information that you need to know. We just want to make sure everyone's safe, patients and staff.
The most important take-homes are if performing that clinical assessment, considering it, and making sure that you're using that enhanced respiratory protection and getting that individual isolated if it's a suspicion.
Absolutely.
And give us a ring.
Yes, please give us a ring. Speaking of giving us a ring, so our contact details are, we've got two numbers. Our extension numbers are 6122 for Gloucester, 3129 for Cheltenham, or we do have a group email address on the global address book. So if you have any questions, please do not hesitate to contact us. We're very happy to answer any of your questions and give anyone a hand.
Yeah, and we'll be continuing to update communications coming out, and as Fran already said, we're going to add a FAQ section just with a bit more information when we have that available to us.
Absolutely. And please see the links with this podcast for all these numbers and email addresses that we talked about. We'll include all of those so you don't get lost. But just to round off and say thank you for listening, and we hope that this has been useful for you, and we will see you in February. We're starting to get to spring.
I know. Please feel free to feedback if there's any sessions that you would like us to run, or just any feedback in general that you would like to give us. Thanks very much, everyone.
Thank you.
Bye.
Bye.